And then she'll be asking the questions that you place in there, following the prepared remarks today. So the first thing that we have for you is our disclaimer, and we use this with each of our presentations. This education is as accurate as we can make it as of today. However, this is a new service we're going to be talking about with the caregiver training, and Medicare rules do change often. The CMS rules and regulations will be the final determinant of coverage. We'll provide responses to your questions based on what you're asking us, but again, Medicare rules determine final coverage. And then lastly, CMS does prohibit recording of this presentation for profit-making purposes. So if you are doing screenshots or recording this presentation, we would ask that you stop. We are recording this presentation, and thank you, Aline, for hitting that button, because I did not hit it. But we are recording this presentation, and it will be available on our website under our Encore page under the Training Center, probably sometime within the next week. And then it will also be available on our YouTube channel, again, once we get it built out there. The next slide that we have for you is just the acronyms that we'll be using during this presentation today. These are kind of all gathered up for you in a single spot. So if you have questions, you'll be able to come back to this and see what that acronym means. So let's kind of talk about what we're going to discuss today. Medicare is now making payment for the caregiver training services. And what this service will do is really provide training to the patient's caregivers in support of the patient's plan of care. So what that means then is the plan of care that you are developing for your individual patients will include the instructions and the education that you want to give to those caregivers for the patient. There's one set of procedure codes to support training on a patient's functional limitations, and then there's another set of procedure codes to support patient behavioral management. We're going to talk about the following: the patient responsibility, appropriate group sessions, time, and then documentation of the service itself. So what we have here is kind of the definition for you. And this is a different type of service in that it's really training provided to the patient's caregivers without the patient being present. So the training is for the caregivers to assist in either the patient's behavioral management or to facilitate the patient's functional performance. The training will be part of an individualized treatment plan for the patient. For example, Mary and Bill may have the same diagnosis and require the same behavioral modifications or functional limitation instructions, but the plan itself will be specific to Mary and Bill. That's not to say that some information and training will not overlap, because obviously it will, but what you want to have documented is that individualized plan for Mary and then for Bill. The caregiver is going to be carrying out or helping the patient to carry out your treatment plan. So when we're talking about behavioral health management, this could be a mental health situation, but it could also be working with the patient for their medical condition, to assist them in doing the things that you need them to do. You're asking the patient to exercise 3 times a week, to walk around the block. Well, part of that instruction to the caregiver is how to help the patient accomplish the goals that you're setting for that patient. This does require a separate patient consent in order to provide the caregiver training services, and that has to be part of your medical record. And I say that way because we know that you have a consent from your patient for the care that you're providing to them. They have signed paperwork that allows you to submit the claim to Medicare, to release that medical information, and then also to receive payment back from Medicare for the services that you have provided. This consent is different. This consent will be specific to the caregiver training services. And the reason for that is twofold. Number one, the patient will not be present for this, so they do have to give you consent to talk to someone else about their health care. And then in addition to that, there is cost sharing for this. So deductible and coinsurance will then apply. So here are the provider specialties that can provide the service. You can see there you have your MDs or your DOs. You also have your non-physician practitioners, and this includes clinical psychologists. And then you also have PT, OT, and SLP, physical therapy, occupational therapy, and speech language pathology. So what is the definition then of a caregiver? And that's up on your slide there. And the patient may have several different caregivers. What we want to notice on this slide particularly is that the caregiver is providing unpaid assistance. So if your patient has home health, for an example, and they have people coming from that home health agency in order to provide them assistance, well, that's a paid assistant. And so any training that you're providing or instructions that you're giving to that home health agency, etc., that will be part of that home health agency cost that would be submitted into Medicare. In addition to that, if the patient or caregiver is receiving reimbursement from Medicaid, for an example, they would not qualify for this training. So it is a person, and again, you can look at the definition there, but it is a person who is really providing assistance to that patient. Now, again, patients can have more than one caregiver, especially when you get into a family situation. So what are some of the conditions that this could be appropriate for? Well, CMS has listed some examples, and those are up on your screen. What you want to be aware of, though, is these are not all inclusive, which means that there may be other situations that you determine or the practitioner determines where the patient could really benefit from providing the caregiver training services to the people who are assisting them with their health care. Patients with dementia, autism spectrum disorder, individuals with other intellectual or cognitive disabilities may require assistance with challenging or changing behaviors to carry out a treatment plan. Patients with mobility issues may need help with safe transfers in the home, help with walking, with doing their exercises, with doing their physical therapy, etc., maybe to avoid post-operative complications. Patients with persistent delirium may require guidance with medication management. Patients with certain degenerative conditions or those recovering from stroke may need assistance with feeding and or swallowing. Caregiver training services can also be used when the condition is mental health. Again, you want to make sure that this is part of the individualized treatment or therapy plan of care. Now, again, these are just examples. Your individualized treatment plan for the patient will identify the patient's condition and the training that the caregiver needs to meet the patient's behavioral or functional needs as part of your care plan. So you can see here some of the included services for behavioral management. Caregivers are taught how to structure the patient's environment in order to support them, to reinforce the patient's behaviors, reduce negative impacts for the patient, and then develop highly structured technical skills to manage that patient's challenging behavior. So the training is going to assist the patient on carrying out your treatment plan. This could be assistance in medication management, ways to encourage the patient to get out of bed and to ambulate. Intended outcome of the training that you're going to be providing to these caregivers is to replace unwanted or problematic behaviors with positive, desirable behaviors. You can use live demonstrations, videos, etc., to educate the caregivers on the skills or the strategies to address that patient's behaviors impacting their physical or their mental health. You would not simply have the caregiver sit down and watch a video, though, while the MD and the DO or the non-physician practitioner is doing something else. This is direct training by those practitioners to those caregivers. One of the questions or comments that CMS received in the final rule, or from the proposed rule to the final rule, was whether or not these services could be provided by ancillary staff, and CMS did not address that question in their response. And so therefore, we would need to look to the description of the procedure code, which I'll show you in just a second. And these are practitioner services unless CMS comes back and changes something. Functional limitations are going to include your activities of daily living, and these are listed here for you on the slide. Safe activity completion, problem solving, environmental adaptation, let me put it that way. So this could be helping the patient to declutter their home, for an example, or helping the caregiver to understand why that's important. If if they have a really big dog in the house, helping the caregiver to understand what needs to happen with that dog in order to help the patient not have a fall, to help the patient not be bitten by the dog, etc. This can also include training in the use of equipment or assistive devices, or interventions focusing on motor, on process, and communication skills. You want to provide the strategies, reasons behind those, and then the techniques to equip those caregivers to assist the patient. Medicare has not set any frequency requirements at this time. However, if you're doing multiple services, multiple caregiver training services for a single patient, you want to make sure that your medical record shows why. A change in the patient condition, a change in your treatment plan, a change in caregivers, whatever is kind of happening with that patient. So for a frequency of services, what you'll want to show in your documentation is, why is this medically necessary for the patient? Whether this is once or you're doing multiple services. Why is it medically necessary? How does it fit into my treatment plan? And what do I want to accomplish with this caregiver training service to help the patient meet the goals that we have set? Time must be the full time as listed in both the primary and the additional minutes procedure codes. So for an example, if one of the procedure codes requires time of 60 minutes and then 15 minutes to submit the add-on code, you would have to have a full 75 minutes in order to bill that add-on procedure code. The billing is going to be per patient. So even if for bill you have 3 different caregivers coming in, you're still going to bill this once under bill. And we'll show the procedure codes here in just a minute. So you could be providing group training sessions for 3 of Mary's caregivers, 1 of Bill's, and 1 of Tom's. You would have 3 charges then that you could submit to Medicare, 1 for Mary, 1 for Bill, and 1 for Tom. If the training for this group is for 75 minutes, you could have charges for the procedure code, the primary code, and then also the add-on code. The procedure codes for the behavioral is for multifamily groups. And the final rule gives a general number of about 6. So this could be 6 caregivers for the same patient, in which case you would just submit once. It could be 6 different caregivers for 6 different patients, in which case you could submit this 6 times. The patient is responsible for cost sharing, as I mentioned before. This would be any unmet deductible and then coinsurance for the service. Currently, what is showing for this service is that the coinsurance is about $4.50 to about $5, depending on the geographic location. And again, that's one of the reasons why you have to have that separate consent, not just the normal consent, but a separate consent for caregiver training services. So these are the procedure codes then that we have. And you'll notice here that it is administered by the physician or other qualified healthcare professional, which are the non-physician practitioners that we talked about. For these 2 procedure codes, one is the primary code, the initial 60 minutes. The second one is the each additional 15 minutes. For these 2 codes, it is multifamily group behavioral management. So you would want to have in your training session, you would want to represent more than 1 patient. Again, CMS kind of gave a general statement of about 6 people within your training session would be the norm. CMS has not in their published information kind of set that in stone, but that is what they alluded to within the final rule. The next 2 codes that we have are individual codes, and these are the functional limitations. So again, you have the 2 procedure codes there. One is the initial 30 minutes, and these are dealing with the activities of daily living, instrumental activities of daily living. And then you have the second procedure code, the each additional 15 minutes dealing with the same type of training. And again, in order to submit that 97551, you have to have at least 45 minutes documented in order to submit that procedure code. Functional limitations also have a group procedure code you can see there. Again, you would want to keep that to about 6 people that you're training at one time. And you'll notice on here that there isn't any time and there isn't an add-on code. So whatever time it is you're spending providing this group training for the functional limitations, you would simply bill this once per each of the patients that you're providing this for. Now, these procedure codes, or the procedure codes 97550, 551, and 552 that deal with the functional limitations, these are considered sometimes therapy codes. So if they are provided by the physical therapist, occupational therapist, or speech language pathologist, they have to be under a treatment plan of those providers. This would be in addition to any information from the MD or the DO or the non-physician practitioner who's treating the patient for the condition. Billing by these practitioners does require the modifiers. You can see there the GN, GO, and GP. If the services are being billed by an MD or a DO or a non-physician practitioner under their plan of care, then they do not have to append those modifiers. Documentation is going to be key to support use of this service. It must be part of the individualized treatment plan. And your best practice is really to be specific. What behavior or functional limitation issue is part of that treatment plan? And what are the specifics of the training that you're providing to that caregiver? So when you think about this one, we'll go back to the example of the stroke. And so that's, going to be in our treatment plan. Our treatment plan is we want the patient to have more confidence in swallowing. We want the patient to be able to feed themselves and to be able to swallow what it is that they're eating. And so we're going to provide the caregiver instructions on maybe teaching the patient how to massage their throat or helping them to massage their throat if they're having some difficulty. Whatever the condition is, and then what you want that caregiver to know so that they can support that patient and help manage either those functional limitations or the behavioral modification so that the patient can reach your goals. Again, if we go back to the example of the stroke, without that additional caregiver training service, that patient may not be confident in actually eating, and so maybe they're not. And so that's causing additional problems in addition to the stroke itself. So that's what you want your documentation to show. What condition am I treating? What behaviorals or functional limitations am I addressing? And then what specific training am I providing to that caregiver themselves? So that's the information that we have for you on caregiver training services. You have a resource up on your slide, and that is a link that you can use if you downloaded the slides that kind of talks about caregiver training services. In addition to that, there's another MLN that was issued, but it didn't come out until after this presentation was complete, and that is MLN 198642. And Aline is going to place the link for that into the chat. And this is under the title of that MLN is Medicare and Mental Health Coverage. Remember, we talked about these are not just medical conditions for which you can use this service, but also mental health conditions. And so the Medicare and Mental Health Coverage MLN booklet also addresses this particular service. So the next thing that we're going to go into then are the questions. And we do have some pre-submitted questions that we're going to go through before we ask Aline to address anything that's in the chat. So one pre-submitted question is, can the service be provided when the patient is an inpatient? And it appears that the answer to that is yes. There is both facility and non-facility amounts in the fee schedule. When submitting, when the patient is an inpatient, then you would use an inpatient place of service code. Documentation would need to show why the training is taking place while the patient is still in the hospital. And again, that goes back to your plan of care. Patient is getting ready to be discharged to their home. Here's what I need that caregiver to know in order to support my medical plan, in order to support the goals that I have for the patient. Another pre-submitted question that we had is the patient's mother came into what they call the tech visit for chemotherapy. Would the caregiver training services apply? Well, there's a couple of things to think about here. Documentation would have to show, again, patient condition, what behavioral or functional situation that you're trying to address, and then what is that training for that patient. And then again, you also need to look at your procedure codes, whether it's a functional limitation, which can be a single beneficiary, or whether it is the behavioral modifications, which have to be multifamily groups. And then you have to look at the time. In order to submit these procedure codes, you do have to meet that time, which is 60 minutes for the behavioral modification and then 30 minutes for the functional limitations. Another pre-submitted question is, can an outpatient hospital submit for a respiratory therapist training a caregiver on the use of the ventilator? And based on what CMS has published at this time, this would not be billed by the hospital. That would simply be part of the services that the respiratory therapist is providing to that patient. And then the last pre-submitted question I have is, can an RHC, rural health clinic, or federally qualified health center submit these procedure codes? I can't find any information to support that an RHC or an FQHC can submit these codes. This would be part of your cost report. So we want to go ahead then and open it up for questions from our chat. Aline?
Hi, Ellen. We do have a couple questions in chat, and I just want to remind everybody, if they do have a question, to put it in the chat there, send it to all panelists, and we'll get those addressed in the time that we have. The first question that came in is from Catherine, and it says, can the consent be included in an E&M note prior to the training, or does it have to be a separate document?
The consent simply has to be within the medical record. And so if you're talking to your patient today and telling them, you know, this is a really good idea for you, I think this is something that can help you reach your treatment goals, and you get their consent today, that's perfectly acceptable. What you have to realize, though, is that if Medicare, one of the Medicare contractors, either WPS as your MAC, the CERT contractor, supplemental medical review contractor, whoever, if they're requesting documentation of your caregiver training service, you have to know where that consent is located so that you can supply that also. So you don't necessarily have to have it in today's caregiver training, but it does have to be within your medical record. One of the things that CMS talked about within the final rule was for patients who have a diagnosis of dementia or Alzheimer's or something along those lines, cognitive difficulties, that it is a best practice to get that consent in when the patient is able to provide that to you. That way you have it, and then should you need to provide caregiver training services going forward, then you have that consent. Next question.
Thank you. Next question comes from Melanie, and it says, is 97550 billed only once during the episode of care, or is it billed each day the caregiver training is provided?
Let me go back to the procedure code. It's billed, the 97550 deals with the caregiver training for functional limitations. And you would bill this when you're providing this service. What you want to look at is, when we talked about frequency, CMS does not have any frequency limitations on this service at this time. You know, depending on their review of data, you know, that could happen some years in the future. But what CMS did address in the final rule was that if you're doing multiple trainings, then you need to show in your documentation why. Did the patient's caregiver change? Did the patient's condition change? Something along those lines. But other than that, you would bill for that procedure code each time you were performing that training. Next question.
Thank you. We got another question from Melanie, and this one says, if a patient is in a group home, I cannot bill for this training because the caregivers are paid?
That is correct. The information that CMS has provided is that it is an unpaid caregiver. So this is family, friends, other individuals who may be involved in that patient's care, but they really stressed that it is an unpaid caregiver. What they said in the final rule, basically, I'm paraphrasing, is that if it's a paid caregiver, then the payment for that caregiver is coming from another source. Next question.
Right, good. Okay, Carla asks, under the non-physician practitioners, I understand that a clinical psychologist is included in this, but would it include a social worker, and she says licensed clinical social worker, or professional counselor?
A professional counselor, no. A licensed clinical social worker is not listed in the CMS final rule as one of the practitioners who can provide this service. The only mental health practitioner that was mentioned is the clinical psychologist. And of course, your MDs for that. Next question.
Thank you for the clarification. That is the last question that I see in the chat so far.
Okay. Okay, then on behalf of Aline and myself and WPS, we want to thank you for the time that you have spent with us today. Again, we do encourage you to take the survey, and this presentation will be available on our YouTube channel probably within the next week. So thank you very much for your time today, and you can now disconnect.